Good morning. Good morning. I'm Jeff Flaks, the President and Chief Executive Officer of Hartford Healthcare. Thank you for joining us today. So often, and I've said this over the many weeks, and I've said this my whole career in healthcare, that we talk way too often about statistics. We talk about numbers, and what we should be talking about is people. In every person we're caring for during this time period, whether they're COVID-19 positive or any person who's under our care, is an individual, and they're a person with a family, with loved ones, with colleagues, with their own backstory. And we always try in our organization to keep that in the forefront and work very hard not to actually report statistics, but describe everything as people. And today, we're really pleased because we're going to have in a moment, I'm going to introduce our medical team who are heroes. These individuals work in our ICUs on the Hartford Hospital campus every day, and they've cared for hundreds of COVID-positive patients in our critical care settings and have enormous experience and expertise and have done extraordinary work working with our nurses, working with our respiratory therapists, and the entire healthcare team to create so many success stories and people who've been able to transition out of our organization to home. Today, though, we're really proud because we're going to share a story about a person, and this person is a colleague of ours. He's a public safety officer, Bialkowski, and Jay is an individual who's a member of our team working in public safety who became critically ill and was in true jeopardy. And recently, Jay was transitioned out of our hospital to Gaylord, where he is receiving additional care. And it was such a great moment of joy and exuberation for our organization to see one of our own, to see somebody who works here to protect everyone within our organization as a public safety officer with that level of critical care, who was in such risk, ultimately to conquer this circumstance and successfully transition from our hospital. So we wanted to share today that experience. We're going to ask Jay to speak about his own experience and his personal experience and the courage that he's had to fight this. And we've asked our physicians to come forward and speak about their experience, both in caring and treating for Jay, because we're caring for people like Jay every day, and for the things they're seeing and experiencing every day within our critical care settings in this crisis. So let me introduce Dr. Sam Pope, who is a pulmonologist and a critical care specialist, a phenomenal physician, and even a better human being to come speak and share these experiences. Please, Dr. Pope.
All right, thank you, Jeff. I'm going to unmask. So I want to thank you. So I'm Sam Pope. As Jeff said, I'm the medical director of the medical ICU at Hartford Hospital. And so it's my pleasure to try to bring this down to a personal level for you guys. So I'm going to set the stage, and I'm going to introduce one of my partners who can tell you the end of the story and then let you all meet Jay. So we first had Jay come in on the evening of the 25th of last month. He'd been to an outside hospital, to the ER when he first started to develop some fever and cough and some symptoms, and was worried about coronavirus. Had been tested but was reasonably well and had gone home. Had come back to Hartford Hospital the evening of the 25th and was very ill. And so in such a short time, he had developed a need for 100% oxygen. All of us are breathing 21%. He had very quickly in the emergency room decompensated, and our emergency room colleagues had to place a breathing tube and intubate him. And so he very quickly went on to a breathing machine, life support, and was then admitted to one of our intensive care unit spaces that night. He was extremely ill as a person gets with this disease, required 100% oxygen on the ventilator, actually required medicine to keep his blood pressure up through the first night and through the next several days as well. He continued to sort of maintain in that location of care, and we started to engage some of our critical care staff, our nurses, our respiratory therapists, PCAs, some of our colleagues, to start proning him. And so that means that we took him from a position on his back and flipped him onto his stomach, which for patients with coronavirus makes an enormous difference in their ability to take oxygen that we're giving them and get it into the bloodstream. And he was having significant difficulty with this through that time. And so through this proning process, on and off, he made it through the first few days, but really was greatly ill, received a number of the medications you all have heard about in the media and read about in newspapers. But by the time we reached the end of April, on the 30th, or on March the 30th, he actually had to be paralyzed. And so we had to give him medicine to completely paralyze him so he could not move. None of the muscles in his body consumed any oxygen at all, just so that we could maintain his oxygen level. And we even had one of our palliative care colleagues reach out to his wife to talk to her about end-of-life decision-making in case that became necessary, because all of us were extremely worried that he would not make it through this. This persisted all the way up through the 3rd of April. And through this time, we continued to prone him. We continued to deliver what I think has been, the skills we've developed over many years inside our critical care spaces with all the team members to provide what is state-of-the-art care. And then I want to stop there because things finally took a turn, and I want to introduce Dr. Panico, who's one of my partners. We had 3 of our physicians who are primarily responsible for his care: Dr. Panico, Dr. John McCardle, and Dr. Natalia Therevska. But Dr. Panico has been with Jay the greatest amount of time and has seen this through to the end, and so I want to give her a chance to tell the end of the story. Thank you.
Thank you, Dr. Pope. And my name is Dr. Megan Panico. I'm a pulmonary critical care physician here at Hartford Hospital, and I'm also the medical director at Gaylord Specialty Healthcare. I have had the honor of knowing Jay for about 5 weeks now, and he has completely transformed how many of us have thought about medicine, and definitely how I personally have thought about critical care. He was one of the sickest patients, one of our first patients to come in. He was on one of our units that was specifically opened for the COVID-19 patients. And he was as sick can get, as Dr. Pope said. But fortunately, with patience and with time and giving his body time to recover, we've been able to see the other side of this. So Jay was successfully extubated on April 10th, a day that brought a lot of tears to the 7I unit. I'm going to try not to cry today. But he was successfully extubated, but we were very scared that day. He wasn't moving at all. We didn't know if he was going to be able to move. He'd been paralyzed for a long time. We know there's an entity out there called critical illness myopathy, and I was worried that we were not going to be able to give him his life back. But a few more days went by. He started to wake up a little bit more. He started to move, and we knew it was time to think about next steps, which was an amazing time because we didn't know if we would get to this point. The nice opportunity for me was it was a time where I was also going to be transitioning from Hartford for a couple of weeks to move down to Gaylord to take on a role there of helping them start to deal with their initial COVID cases, and for Jay to be the first case that was brought into Gaylord. He was brought in there. He was very scared at first. He was very tearful. He was very thankful. But he didn't know what he was getting into. And the transformation that I've been able to see in 2 weeks has been absolutely amazing. He's gone from someone that couldn't move a muscle, that could barely squeeze my hand the day we extubated him, to walking around with a walker, to now walking independently and going home very soon. His recovery has been absolutely remarkable. It has taught all of us that people can recover from this. I'm now able to say to other COVID-19 patients and families that we can do this. Despite how bad it is and how sick everyone is, there is an end in sight, and we are seeing people recover. I'm seeing people walk around, and I'm about to see people walk out the door and go home over the next few days that I did not think were going to make it. So with that, I would like to introduce Jay Bialkowski.
You are on the double screen.
Okay, perfect. So Jay, would you like to tell them a little bit about kind of your experience with all this?
Sure. I went to work, started feeling I had developed a fever, and I went home, tried to control that, and it got to a point where I was in my room, and I was kind of fighting to breathe. And I remember yelling to my wife and daughter who were in the hallway, kind of freaking out. And I remember yelling 911, call 911, because I couldn't breathe. And then they did, obviously. The EMS showed up. I don't really remember much more. I remember going to the hospital, going into the ER, and that's pretty much all I remember over the next 3 weeks. And then I'll never forget, a week ago Monday I was transferred here, and I remember feeling it was a windy, rainy, cold day. I remember how amazing the wet rain felt in my face as they were transporting me out of the Compton building to the ambulance with it seemed like 50 or 60 people out there cheering. It was really, really amazing. It really was. And I certainly don't know how to thank everybody from the ER to the ICU to step down, to complex, everybody involved who helped in my care. And thank you so much for basically saving my life. You never gave up, and I appreciate that.
Jay, this was really about you. I think you and I have sat down and had this conversation many times over the last couple of days of, I think your inner spirit and your ability to fight through this is what got you through it. Can you tell everyone a little bit about kind of how your recovery has been over the last couple of weeks of getting stronger and what it's felt like and how you feel now?
Sure. Coming here to Gaylord, I was very fortunate that I was able to get in here. And I can tell you that one of the inner statements that I live by is that determination is the key to success. And that's been with me for years and years. And I got here and didn't know what to expect. All I wanted to do was go home to my wife and daughter. But I know I had to fight through this and get my body back. And I said, okay, let's do it. So the team here is absolutely amazing. They push you and push you and push you. And I said, give me more. Just
that is true.
Let's do this. You know, I want to set a record, and I think I did. I wanted to work hard and get my body back, and I did. I have a long way to go, but I'm certainly on the mend, and I'm in great, great shape compared to where I was. And I'd like to also introduce to you one of my occupational therapists, Katie. She was one of the instrumental people in beating me up on a daily basis, which was, I'm grateful. I can't thank her and the whole team enough for they're such ultimate professionals. And what struck me mostly is everything here, everything they do is from the heart. They really, really care. And I'm so grateful to have had the opportunity to be a part of that and get that treatment that they offer. I'm grateful.
Katie, can you tell us a little bit about what it's been like to take care of Jay? I know one of the big things that we started here at Hartford Hospital was involving the rehab professionals as part of our proning team, which has made a significant difference in our ability to prone patients early, and we've continued that at Gaylord. Can you tell us what it was a little bit like to take care of Jay at Gaylord with the rehab team and see his progress?
Absolutely. So I remember meeting Jay for the very first time. I walked in his room to do his evaluation, and he was so weak that he could barely sit up in his wheelchair. So it took 2 people to get him out of bed into the wheelchair the very first day. We met him, and I had to help him position his arms just to keep him upright because he didn't even have the trunk control to keep himself sitting up. He had barely any movement in his arms at all. He was dependent and relied on someone to feed him for every meal. He was dependent and relied on someone to help him with getting washed and dressed and ready for the day with his ADLs. And he relied on someone to help him even with, the most daily task of having to use the bathroom. So when Jay came in, I knew that it was going to take a lot to help him get back on his feet and, make the recovery that we were determined to help him with. However, Jay had his own agenda.
He has the whole time.
So yes. So that was the very first day I came in. And actually the second day, he was still extremely fatigued that he could barely participate in therapy. However, come the third day, he wanted to get up and try standing up. So we got him into the parallel bars just to try to stand up. But he didn't want to just stand up. He wanted to try those first steps. So Jay took the first couple steps and walked right down the parallel bars. And from that point on, he kept progressing so fast that I could barely keep up with him myself. So he went from being dependent and relying on two people to help him get out of bed, to then standing and walking in the parallel bars with some assistance. We then transitioned to helping him walk on the unit with a walker. And by the fifth day, he was walking without an adaptive device down the hall from his unit. So he absolutely took off in the fastest recovery I think I have ever worked with someone. And I know it was that determination to keep going and keep putting one foot in front of the other that got him to the point he's at. And over the last couple days, we've been continuing to help increase his strength, increase his endurance and stamina and his balance in preparation for finally being able to get back to his wife and his daughter, which has been his absolute ultimate goal since he first came to Gaylord.
So Jay, I just want to thank you for the opportunity to take care of you over the last 5 weeks. As I said, I was going to try not to cry here, but honestly, you have changed the game for all of us. You have given us hope. And I think that we now know people can get better, and I think that's going to change it for us. So thank you. And I'm looking forward to seeing you on the outside of this someday with no mask. Hopefully someday we can go back to real life again. But thank you.
I do want to go off that as well, and I have to say thank you, Jay, because it's patients like you that help us to stay strong and help us keep coming to work to do the job that we're here to do. And you keep us going and keep us motivated because of the progress that you make. We know that this is possible, and it's worth every ounce of what we do to get to the point that you're at, to finally be able to see you go home to your family tomorrow.
I really appreciate that, and I got to tell you, it's a team effort, I think, on both sides. It really is. I couldn't have done this on my own. I needed to push, and I think one of the most important things throughout this rehabilitation has been, you're not holding me back. If I want to do it, you're going to push me. And you did. And I'm so eternally grateful for everything.
You've done amazing. You have earned everything where you are right now. You have got yourself to this position, and I agree. I think it takes an entire team, an entire village. And that's exactly what we've done in this situation, with the most positive outcome.
Great people, absolutely incredible people here. Yeah. Thank you.
You are welcome. Thank you.
Is there any questions at all?
Tina, can you, it's Greg Lackey from the Mirror. I would like to get, if you could email me the spellings of the names of everybody who's involved here.
Yes, will do, Greg.
Today.
Yes, absolutely.
Thank you.
Tina, this is Emily from The Current. Would you be able to send those spellings to all of us to make sure that we get them right?
Yes, you bet.
Okay, thank you. And then I also had a question for Jay. Could you tell us a little bit more about yourself, how old you are, what town you're from, a couple things like that?
Sure. Just turned 54 years old. I live in Glastonbury. Been there for about 30 years. And worked at Hartford Hospital, I think, since 2008. I'm a retired police officer. Retired in 2011 from the state. And now work at Hartford Hospital in their day shift security position.
Thank you.
Any other questions?
You want to come in? Okay, I'm going to have Dr. Pope come back.
No, so Jay, I just want to thank you for keeping us safe, and it's our absolute pleasure to be involved and to help you recover from this. Absolutely.
I appreciate that, and I thank you and your entire team for everything everybody has done. I can't thank you all enough. I
No.
really can't. My wife and daughter are the ones that deserve all the credit for dealing with everything, since I really don't remember much. And I have to give my wife and daughter all the credit. They're the ones that took the phone calls on a daily basis and went through a tough time.
Absolutely.
So they got the reality on a daily basis.
Well, we're all looking forward
Sorry
to.
they had to go through that, but we're here now.
I agree, and I think it's going to be a great time when you get back home to them, and I'm glad we could be a part of that.
I can't wait, and I appreciate everything everyone's done.
Absolutely. Well, we will let you guys go, and if there are no other questions on the line, we'll sign off for now.
I actually do, this is Emily from the Current. I do have one more question. Do you know how many people have been discharged from the Hartford healthcare system at this point?
450.
About 450.
Thank you.
And Bridget from the Republican American, how many of those 450 came even close to being as ill as Jay?
Not as many. We do have those, and the problem with the people who are like Jay is that the recovery lags, and so as the numbers have come into the hospital, the sickest people leave later, and so we are having those stories now, and I will tell you guys, he's not alone. By the time we get to June or July, we'll be able to give you some accurate numbers about this, and I'm hoping that we're going to have some, amazing statistics to share due to the excellent care that our teams have provided. But Jay is not alone in this. I will tell you that there are a number of others that we've been able to get out of the hospital that have sort of changed the way that all of us have thought about what we're doing with COVID-19.
Thank you.
All right. Thank you guys so much.
Thanks, everyone.